Hello everyone!
Hi guys!
Thank you for joining us. This is
Rachel England, LMT.
and I am Devin Doffel, LMT. So Rachel, can you explain to us what LMT means?
Absolutely, I can.
Or stands for, I guess.
Licensed massage therapist. We're licensed through the state of Connecticut to practice massage.
Yeah, and so massage has what we work within what is called a scope of practice. And Connecticut has a very specific definition for what massage therapy is and what it isn't. So, Rachel, can you tell us what it is? So what is within our scope of practice according to Connecticut?
I better be able to tell you.
I know. I bet not every massage therapist knows this, but it's true. Yeah, we should hope.
Yeah, in the state of Connecticut,
that's right.
the function that we serve is to manipulate soft tissue.
Yes. I knew that.
Yeah, all your connective tissue, skin, fascia.
Yeah, muscles. And they're all like super important for the way that your body moves. And we work really hard. We go through a specific training process. We're required to have a certain number of hours of training before we can even get licensed. And then we continue that through continuing education. Mm-hmm. So we're pretty skilled, I would say. Yeah. So it's probably also important to talk about what we're not. So what is out of our scope of practice, according to Connecticut?
Yeah, so according to the state of Connecticut, we cannot diagnose anything that
we're not doctors.
We are not doctors.
No, we love them. Doctors. We love working with them.
Absolutely.
Not doctors.
Wonderful conjunctive therapy, but
very cool.
Yeah, we're not here to diagnose you. We can, however, assess what is happening in your body, and the reason that we can do that is because we're muscle specialists. We've gone through rigorous training. State of Connecticut requires at least 500 hours of classroom time, 250 hours of clinical time, and of course our training does not stop there because there's so much to learn about the human body.
Yeah, absolutely.
And I think that most of our training and most of our lessons come from each individual client that lines up on our table. The more hands that we have on clients, the more clients we have on our tables, the more we learn.
Right, this is absolutely true. Yeah. We have a lot of experience, so we are absolutely a specialist, a tissue specialist. Yeah. We have a lot of experience working with people, so in helping them with lots of different things, but we're absolutely working with the connective tissue in the skin, sort of the sensation in the skin, and because we touch so many people, we have a sort of a memory of the way all that tissue feels, and it really helps us provide some excellent assessing of the tissue, which is useful for some of the different professionals you may also be working with. So we can play a really cool role in integrating into your healthcare.
Absolutely.
Yeah.
We don't manipulate the skeletal system at all. Sometimes adjustments will spontaneously happen on the table. Right. Every now and then you'll get that
crack and
pop and shift, which feels really great.
We're not doing those accelerated, faster. No, we'll leave that to the chiropractors.
Absolutely.
Yeah, we have our hands full enough as it is. Yeah. And we're happy. And we'll be studying the connective tissue muscles movement systems for our entire career. And there's so much to know about it. So we're happy to stay within our scope.
Absolutely.
Yeah.
What are some of the things that we learned in school, though?
Oh, so many things. And we went to different schools. So, there's a core curriculum that will most of us learn pretty much the same thing, but a lot of anatomy, so the parts, the muscular parts, and the bony parts. A lot of physiology, so movement, the way that the parts work together. We do learn the major systems and how to work with them and how not to harm them. Yep. So we learn a lot about pathology, so injuries and disease, and how massage may or may not affect. So we work really hard to make sure that your treatment is healthy for you and supportive for whatever you may be going through.
And I think learning pathology was paramount in school because, one of the things that we have to really know in order to be a responsible massage therapist is what helps and what can potentially cause harm.
Right.
Okay, because massage therapy affects all the body systems, So there are certain conditions or some pathologies that we may need to adjust our techniques on.
Yes.
Or not even massage you at all if that's the case. There are certain circumstances where massage could cause harm.
Absolutely.
That's the first thing that we avoid doing with any client, and that's why we wind up doing extensive intakes with clients. We're not trying to pry into your business saying, what medications are you on and what type of surgeries and, what type of pathologies have you been diagnosed with. I'm not trying to get into your personal business. It's important to know in order for us to be responsible with you and your body and your health.
Right. Yeah. No, I mean, the first thing that comes to mind is blood thinners. A lot of people are on them, and so we may have to adjust our technique if you're taking them. It doesn't mean you can't come in. It doesn't mean we can't help you, but it's definitely important for us to know. And you never know what kind of medication you're on that may be important for us to know. And we're trained to make sure that we give you a massage treatment that will not harm you and that will ideally help you. So yeah, it's pretty cool stuff. We're psyched. We love it. A little biased. I'll be doing this for the rest of my life. I'm like so fascinated with the body and how it works.
I'm passionate about it. I'm passionate about the work because I just love people.
Yeah, which is cool because there's a lot of people.
There is a lot
as
of
part
people.
of this. Yeah, if the people didn't come, we wouldn't really have anything to do. So we definitely love people.
Yeah.
So yeah, we look forward to seeing you. And if you have any questions ever about anything, just email us. It's welcome, WELCOME, like welcome, at resilability, RESILABILITY,
MOUSC. No.
except for the mouse. It'll probably take you somewhere completely different. .com. So that's that is our email address. So you can email us and we'll be happy to answer your questions or get you in. Anything else to add, Rachel?
I'll have to see you on our table.
Yeah. Thanks for joining us. We really appreciate it.
Bye.
Have an amazing day and bye. That was a good one.